What do you mean by angina? Angina is a choking or constricting chest pain associated with exertion. How is heart failure diagnosed? It is diagnosed when a patient shows the symptoms of low cardiac output, pulmonary congestion, or systemic venous congestion. What should be the advice in case of patients with heart failure, like less salt intake, etc.? What are the indications of diastolic murmurs? These are indicatives of abnormal pathology. Continuous murmurs result from or combination of systolic and diastolic flow. Mention the other manifestations of cardiovascular disease like edema, palpitations, syncope, etc. Why does edema occur? It occurs due to excessive salt and water retention. What does edema indicate? It is the symptom of chronic heart failure. It usually affects the ankles, legs, thighs, and lower abdomen. Edema of nephrotic syndrome is more severe and often affects the